Local, late breaking. This is WBAL TV 11 News Sunday morning.
In this morning's medical alert, swimsuit season is closer than you think. Get yourself summer ready with these 4 new plastic surgery trends. Dr. Michael Cohen from Belcara Health is joining us to talk about them. Good to have you on the show this morning.
Good morning. Happy holiday.
All right. Happy holidays. Yes. So what are the hottest trends? What are you seeing right now?
So we're seeing a lot of things in plastic surgery that are sort of fun and interesting. Some are invasive, like surgical procedures, and then some are non-invasive that don't involve surgery, but involve procedures that we can do in the office.
Okay, so first one, fat freezing. What is that?
Yeah.
First of all, I'm really excited to hear about this.
Right.
Forget about the gym, no time, right?
Well, the donut man's coming next, so we can talk about that after.
That's true.
But fat freezing is CoolSculpt, and it's a very, very popular item. It's something that we do in the office. We actually have 2 devices. So when people come in, they typically have fat on both sides of their body. We can apply this device for just 1 hour, and it actually freezes the fat, kills it. The body absorbs that fat, excretes it over the course of about a month. And it's really good for people that have sort of a little bit of loose skin, a little bit of fat, some of that spillover, that muffin top, so to speak.
Yeah.
And it works really, really well.
And that's oftentimes the hardest area to get rid of.
Sure.
All right. Fillers, what are those?
Well, fillers are things that are used to plump up, rejuvenate, enhance an area. Typically on the face, we use it in the 11s, which are sort of on the between the brows. We use it for the nasolabial folds, sometimes on the cheeks and on the jawline. So it's a filler that lasts typically 6 to 9 months, called hyaluronic acid. Several different popular brands are out there, and we use many, many of them. And you inject it, and it can last for a good long time.
So primarily on the face?
Yeah, sure.
Yeah.
People are using it in other areas, but it's mostly for the face.
Like Botox?
Botox is a neurotoxin. It's a device, or it's a medication used to sort of stop the nerves from contacting the muscles, so the muscles don't work and you don't get wrinkles and ridges.
Okay, well, let's talk about neograft
Sure.
hair restoration. I know this is popular right now.
This is a really, really good tool that we have. Neograft is a machine that actually extracts follicular units. So these are little things, we don't call them plugs any longer, but they're little tiny blocks of tissue that have 1, 2, 3, or 4 hair follicles in them. And those could be used to implant in other areas that are deficient. What's great about it is it doesn't involve a linear scar, no incisions to close up. It's done, and within 24 hours, the little holes where the hairs were removed close up really nicely.
All right, so breast reduction, this is popular. It used to be women wanted to, augment, get larger breasts, but not so much anymore.
Well, yeah, there's still a large number of people that want to augment. We're trying to do more natural-looking augmentations. Patients don't seem to want the overdone look. Breast reductions are always popular because some patients are encumbered with very large breasts, have had that since early teens, and they want them reduced and made to look pretty and uplifted.
And if you'll hold up some of those samples here, I mean, what kinds of things are they using, the material?
Yeah, well, these are silicone gel implants. We almost exclusively use smooth round implants, which are really deemed to be safe. They're FDA approved. We love them. They provide very natural looks. They're making them a little bit differently these days, so they're not as worrisome as the ones of the 60s and 70s.
Okay,
Yeah.
Dr. Cohen, thank you so much for your time. All right.